We're talking about that in our conference a lot now, and it's going to be one of the major means of early detection of little bits of fluid in the tissues. Right now, with our equipment, if you've got that much more fluid in your left arm over your right arm, we can pick up the difference. And long before we can measure it with a tape measure, we can pick it up with bioimpedance spectroscopy. So in other words, we can pick up little bits of fluid and react and treat it and send it in the right direction. Get rid of that fluid as quickly as we can, as long as we pick it up early. So that's really important. For those of you who are at risk of lymphedema, that is, you don't have a swollen arm but you want to keep it that way, then an early assessment using bioimpedance spectroscopy is really, really important way of doing it. And eventually therapists will have more and more of these pieces of equipment to be able to help you out with your swelling. And you can see here, this is just a picture of what it looks like for the machines. You can see here, bioimpedance spectroscopy can pick up a difference long before you know there's a difference or a problem, and long before, by putting your arm in some water or having your arm measured with a tape, you can pick it up long before these other methods can. So the most important thing about measuring your arm or your leg, early detection of that little bit of extra water in the tissues. And if it's there, put your arm up in the air, do some exercise, do some breathing, and get rid of it. And while we're thinking about that, it's time to actually do some. So here we go, up. Tighten your muscles in your arms, breathe in, hold it. Now breathe out and loosen your muscles. Right out. Every single bit of air has got to go out. Here we go again, breathe in. Hold it. Breathe out. Every single bit of air has got to go out of your chest. And you know what you've done then? You've changed the pressure in your tummy and your chest enormously. And any fluid that's in there now has moved into your blood vessels. And now the fluid right now is starting to move from my arms, okay, into my chest, moving from my legs into my tummy area and clearing away from where it's been sitting around. So we've just helped the lymph flow. And if you're interested in our trials that we've done on this, if we do this 5 times a day for a week, it gets rid of about 80 mils of extra fluid. 80 mils. This is about 80 mils of fluid out of your arm just by doing the breathing properly, okay? And I think Margarita's and Helena's got some of those handout sheets somewhere, electronic ones. Okay, so the most important thing now is what's coming up in my last 20 minutes. Once we know what's happened to your lymphatic system by a measurement, only then can we do the right treatment and make sure that treatment is right for you, that it's targeting you. Just want to see if you can get me down here. Yeah, you can, yes, good, well done. Okay, so what we have to do, we have to target the treatment to the information your therapist has got, or the information that you've given the therapist. You have to be honest with your therapist in terms of your history, your medications, and what else has gone on. Really, really important. So there's the crucial thing. They have to know what's gone wrong with the lymphatic system to give you the best treatment that's targeted and the best treatment in terms of its sequence. You know, you have to sequence the treatment. It's not much point me coming up now and doing some MLD on you if you haven't done some breathing, if you haven't cleared out the root of the extremity, okay? You've got to think carefully about sequence. Okay, so what we now need to ask ourselves, what are you going to do to help your arm or your leg today? Are we going to reduce the load on the lymphatic system? Okay, that is, you know, somehow get the fluid load down so there's less of a load for it to carry. Or are we going to actually make what's left of our lymphatic system work better? And that's the most important thing. Do we want it to work better, or do we just want to reduce the load on it? Now, an example of reducing the load on it might be, if we've got high blood pressure, get it reduced a little bit, or relax. Get rid of stress, okay? Or it might be lose a bit of weight. Or it might be something as simple as this. Look at your fingers right now and have a look around your cuticles. And if your cuticles are dry around there, that could be causing an extra load on your lymphatic system of about that much per day. 5 mils. Not much, is it? But what about at the end of the week? the end of the month. There it is. There's your swelling. So, you know, taking better care of your skin may make that sort of difference. So little things with the lymphatic system can make the biggest difference. They're little things because every day it's just a drop. In a week, it's a lot more. And in a month, it's pretty serious. But it happens generally, progressively and slowly. But you can reverse it. You can actually get that little bit of extra fluid to drain out every day, and eventually that swelling will go down, especially if it's in the early stage, okay, the fluid stage. So just think that sort of thing. So reduce the lymph load, increase the lymph transport. What are we going to do? Well, here are the ones that we can measure about reducing the lymph load, and they're so simple, and yet they make such a big difference. And they're the ones I've talked about. Skin as a barrier, events which raise your blood pressure, make blood vessels stronger. Who notices that as you get older you bruise a little bit more? Okay, I do. If I hit myself a lot now, I bruise a lot easier. That's because my blood vessels are not as strong as they used to be. And there's all sorts of medications around that can help make your blood vessels stronger. And you need to talk to your GP and therapist about that. Cuts, wounds and scratches are super important. Weight and fats are important. And compression garments and bandages are important. But you know, they work better if you're doing some sort of exercise or changing the pressure or the muscle tension under those. Now, you don't have to put up your hand, but I presume a lot of you might have been thinking about or had some bandaging, some garments, or some compression pumps on you at some stage, okay? If you have, how much have you prepared for those? Have you prepared your body? Have you prepared the lymphatic system for them? Well, the answer is you should prepare for these sort of treatments by trying to minimize any tough fibrous tissue along the pathways. In other words, if it's tough and hard, we need to probably soften it a little bit first to make sure the fluids can move, to make sure the lymphatic vessels can pump like this, because if they can't pump like this, they're not taking the fluids away. Okay, just remember the jellyfish. Your lymphatic vessels got to behave like a jellyfish to get the fluids along them. So we have to watch out for fibre. We also have to make sure we do this, clear the proximal pathways. And remember my first slide. My first slide was this, remembering that the fluids from my toe come all the way up here, all the way up my tummy, all the way up to my chest to here. And the proximal pathways from my legs are here in my chest and my tummy. And when you was doing this, that's what you're doing. You are clearing these proximal pathways, and that's most important. And if I had my equipment here today, I could show you, even on every one of you, how that will actually help clear the fluids out of your leg or out of your arm once you've given it a chance. And sometimes it's nice to see that. The next thing here, unobstructed flow. In other words, you don't want to have underwear which is tight in your groin, or you don't want to have a bra which is really tight here on your shoulder, or around here, or under here, because that's going to slow down lymph flow. In one of our talks yesterday by Peter Mortimer, he showed quite easily that when you've got high pressure on your lymphatic vessels from the outside, lymph doesn't flow so good. Okay, so you've got to minimize external pressure. There's some interesting research that says even sitting down like we are on chairs with our knees, how can I do that? I can do it here. You see, is that safe?
I don't know.
It's sweet. Is it IKEA?
I don't know. If it's IKEA.
No, I wouldn't do it. No. You see how I'm sitting here at the moment? I've got a lot of pressure here, haven't I, on this part of my back of my thighs, and that's actually slowing down lymph flow, and that's not so good. So if you're sitting, you need to even the pressure out. The most important thing is even pressure. Don't have constant pressure for a long time in just one spot. You can have a lot of pressure, but it has to vary. You have to vary the pressure, which is why if you've got a garment on, if we might have should I put a garment on? If I've got a garment on, this garment's great. It'll be better if I put my hand up in the air every now and then, but it'll be better still if I actually move my hand or my arm with the garment on, because I'm helping to load the lymphatic system. Remember, if I don't put the stuff in the system, if I don't put the stuff in the water in the bucket, nothing's going to happen. It's going to sit in the tissues. So we have to get the fluids into the bucket to get it to be carried away. We have to get it into the pipes to get it to be carried away. Do you have septic systems here? Do you know what that is? We live in the hills. We don't have any yes. Yeah. We don't have any water except everything stays where we live. And you know, sometimes the pump has air in it. When the pump's got air in it, we've got to add water into it to start it pumping. But once it starts pumping, it works well. And it's exactly the same with the lymphatic system. You've got to put the stuff in it, you've got to put the fluid in it to get it working well. Okay, just a couple of other things about what we're talking about. You remember, we're talking about picking the tissues here, feeling it, feeling what's like here compared with here. That's measuring fibre a little bit in the tissues. And if you pick up fibre, then you need to look at trying to break up the fibre. And you can break it up with a little bit of frictional massage. In Australia, we use primarily laser treatment. Most of our patients will get some laser treatment initially to soften the tissues, to make the fibre break up, to make the fluids easier to move. And we can measure that via tonometry. The other thing that's most important is what I talked about before. Watch out for underwear and garments, which are here in the groin. Watch out for things around the knee here. Look at your bras to make sure there's no pressure on the shoulder or the lateral chest or the here under the breast area, because the fluid from your breast wants to drain down to your groin area and then get taken away again. The fluid from your arm sometimes, if there's no lymph nodes here, is wanting to come up here along this pathway. And if you've got a really tight bra strap there, it's not going to get out all that well. So think about that. Think about the big picture. Here is one of the more important ones that you have to think about. Because our fluid from our feet goes into the tummy and then the chest, we have to ask ourselves, what about my diet? What about things in my diet? Do I get bloated? Do I have gas? Because if you do, that external pressure may slow down the lymph flow from the legs. Everyone understand that? Okay, watch things that bloat you. Watch abdominal adiposity and make sure that you're not constipated, because when you're constipated, there's a lot more mass in the intestine, and that stretches and that puts pressure on the lymph vessels and slows down drainage of the lymph. It also slows down drainage of the blood as well, but the lymph is what we're concerned with. So just watch out for these simple things. Simple things make the biggest difference. Managing those things can make a difference to your lymphedema. Here's your most important one of all. You know, we did the clinical trials on this, and exercise and activity is the best thing you can do. And so far, that's one of the most simplest things that makes the greatest difference that we've found. Other things that we know and that we can measure is electrical stimulation. We've done some work, and other people have done some work on stimulating the lymphatics electrically. Who remembers the old TENS unit? Is there any nursing people here? The TENS units, you know, you zap, it's good for zap the arms and the legs or a part of the body, and yeah, the pain goes away. But similar to the TENS unit now, there's some units which actually, whoa, it's different. I'll do that again. When you deliver some electricity to the lymphatics, it makes them pulsate. And they just squeeze a little bit harder and a little bit faster and do a little bit of a better job. So that's electrical stimulation. Do you have something over here called the circulation booster? Or the venous booster or something like that? It's all the rage in Australia at the moment. It's not this machine, but it actually, you put your feet on these little things and you get an electrical shock every 10 seconds. And it makes you jump a bit. And it helps the lymphatic vessels work a bit better, apparently, but they haven't done enough study on it. So be careful of funny things. But certainly in some of these instruments, especially designed to make the